Hi, welcome to Professional Certifications channel. Let's break down NCLEX exam preparation, one topic a day for focused and effective learning. Today's topic is feeding tube care.
What is a feeding tube? A feeding tube is a medical device used to provide nutrition to patients who cannot eat by mouth. It's commonly used for patients with swallowing difficulties due to stroke, neurological disorders, or surgery, chronic illnesses, such as cancer or severe malnutrition, critical conditions, like coma or severe trauma. Feeding tubes can be temporary or permanent, depending on the patient's needs.
Types of feeding tubes. There are several types of feeding tubes, each suited for different needs. 1. Nasogastric (NG) tube, inserted through the nose into the stomach. Used for short-term feeding. 2. Percutaneous endoscopic gastrostomy (PEG) tube, surgically placed through the abdomen into the stomach. Used for long-term feeding. 3. Jejunostomy (J) tube, placed directly into the small intestine. Used when the stomach cannot be used.
Step-by-step guide to feeding tube care. Now let's walk through the steps of proper feeding tube care. 1. Hand hygiene. Wash your hands thoroughly or use an alcohol-based hand sanitizer. 2. Site care. Clean the insertion site daily with soap and water. 4. PG tubes. Clean around the stoma and check for signs of infection, e.g., redness, swelling, discharge. 3. Flushing the tube. Flush the tube with water before and after each feeding or medication administration to prevent clogging. Use a syringe to gently push water through the tube. 4. Administering feedings. Follow the prescribed feeding schedule and formula. Use a pump or gravity feeding bag as directed. Ensure the formula is at room temperature to prevent discomfort. 5. Securing the tube. Ensure the tube is securely taped or fastened to prevent dislodgement. For NG tubes, check the tube's position regularly to ensure it hasn't moved.
Tips for effective feeding tube care. Here are some additional tips for effective feeding tube care. Monitor for complications, watch for signs of infection, tube dislodgement, or feeding intolerance. Maintain hydration, ensure the patient receives adequate fluids either through the tube or orally if possible. Rotate the tube. For PEG tubes, gently rotate the tube daily to prevent skin breakdown. Document, record the type and amount of formula, any medications administered, and the patient's tolerance. Educate the patient and family, teach them how to care for the tube and recognize potential issues.
Common mistakes and how to avoid them. Even with the best intentions, mistakes can happen. Here are some common errors and how to avoid them. Improper cleaning. Always clean the insertion site and tube thoroughly to prevent infections. Inadequate flushing. Flush the tube regularly to prevent clogging. Ignoring signs of infection. Monitor the site closely and report any signs of infection immediately. Poor documentation. Keep detailed records of feedings, medications, and patient tolerance.
Conclusion. To wrap up, proper feeding tube care is essential for ensuring the patient's safety, comfort, and nutritional needs. By following the steps and tips we've covered, you can provide effective care and prevent complications.